The area of integrative oncology really refers to a lot of what used to be called complementary and alternative medicine, but when it's integrated with standard oncologic care, the term we use is integrative, and along with that comes the notion that it's evidence-based, that we're using approaches that have a track record, that meet the levels of evidence needed to incorporate something into standard therapy. And we tend to think of things like acupuncture, which actually does have a lot of evidence behind it, especially in the field of arthritis, where randomized studies have been conducted and show that it's an effective way to alleviate pain, and more recently in cancer it's been shown to alleviate fatigue and nausea. And it's still being investigated in trials. We actually have a trial open at our center that's being led by Don Hirschman at Columbia University, looking at acupuncture for aromatase inhibitor-induced arthralgias in early stage cancer. A pilot study showed that it appears to be effective, and now we're doing a randomized controlled, sham-controlled trial where patients get true acupuncture, or they get what's called a sham acupuncture, where the needle doesn't go in all the way and it's not in the right points. We're doing that to just make sure it's not the whole process of sitting down for acupuncture, and then a true control where they don't get any of those, and we're looking at pain and disease. At USC, we want to really develop a whole center to do this, so we actually have just recently obtained some funding from the provost office to have a series of meetings to bring the community together. We want to really make this an interdisciplinary group, not just among medical disciplines, but also bringing in people that work in the field of communication, graphical arts, religion, philosophy, engineering, truly multidisciplinary, so that we can start to look at those modalities that have a strong track record historically, but need more evidence. So this would include things like botanical medicines, herbal therapies, a lot of mind-body approaches, things from group therapy to yoga. We're studying those formally now in randomized trials. So many centers across the country now are opening integrative programs, and our goals are similar. We want to study these approaches, we want to know what works and what doesn't, and we want to integrate it into the standard of care. I think patients deserve the kind of cancer care that is broad-based, that is open-minded, but that's evidence-based, so that they can integrate both of what the Western biomedical molecular biology world has to offer, and also some of the traditional approaches that help with quality of life and may even help with the course of cancer.